We'll start with the first question, my dears. A 65-year-old who came for his general health checkup, says that he was on an anti-gout medications for the past few months. After the investigations, it says that his total uric acid levels in 24-hour urine sample has significantly increased compared to before treatment values. What might be the probable drug he would have been on? This patient is under a therapy with an anti-gout medications. So let's look into what exactly is gout. Gout is nothing but hyperuricemia, guys. Gout is nothing but hyperuricemia. Increased uric acid, increased uric acid accumulation. If it is getting accumulated in certain areas where the blood vessels are a little bit narrow, like which is there on the peripheral areas, these molecules will gain entry into the joints and start producing inflammations in those areas. Now, the take-home point over here is for treatment, if a patient is presenting to you with symptoms, please understand that if a patient is presenting to you with symptoms, this patient is diagnosed as acute gout. If a patient is presenting with symptoms, this patient is diagnosed as acute gout. Whereas if the same patient is presenting with no symptoms or the symptoms has been corrected, then we can diagnose the patient as a chronic gout patient. So what if we diagnose a patient with acute gout or chronic gout? How do we treat the patient? Treatment is entirely different, guys. Acute gout and chronic gout treatment is entirely different because in terms of acute gout, we have to treat the inflammation first. So anti-inflammatory agents like NSAIDs or steroids like SAIDs or colchicine, these drugs are the drugs which can be used for management of inflammation associated with the acute gout. For chronic gout, the treatment is going to be, we have to administer a xanthine oxidase inhibitor like allopurinol. Or we can administer an uric agent. We can administer an uricosuric agent like Probenecid. We have multiple other drugs which is given in this list, but we're not going to be talking about the whole drugs, guys. Let's discuss these questions as per direct. So what's the difference between these drugs, my dears? What's the difference between this NSAIDs, steroidal drugs, or these drugs which is going to be useful for the treatment for chronic gout? These drugs, which is your NSAIDs, SAIDs, and colchicine, are purely treatment for the inflammation, treatment for the pain. Whereas these drugs like allopurinol or probenecid is going to be decreasing the uric acid levels. How do we decrease the uric acid levels? By administering certain drugs like allopurinol, which will decrease the synthesis of uric acids. First point. Allopurinol will decrease the synthesis of uric acids, whereas probenecid will increase the excretion of uric acid. Probenecid will increase the excretion of uric acid. So the take-home point here is, when you administer, please note it, when you administer allopurinol, the serum, what will happen to the serum uric acid levels and what will happen to the urine uric acid levels? Serum uric acid and urine uric acid levels. Similarly, when you administer probenecid for the patient, what will happen to serum uric acids and what will happen to urinary uric acid levels? The point here is, when you administer an allopurinol, the serum uric acid levels will be decreased and urinary uric acid levels will be decreased because synthesis बंद हो गई. अगर synthesis बंद हो गई तो कैसे वहां से urine से निकल गई? It will not be coming out of the urine also. तो serum जो है, blood जो है, उसके अंदर uric acid जो है, that also will be decreased. So patients will be having better control of the uric acid levels. But on the other hand, probenecid is a drug which is uric agents, guys. It will increase the excretion of uric acid out in the urine. That's why serum uric acid कम हो जाएगी और urinary uric acid levels is going to be increased. Because uric acid कैसे body से बाहर जाए? It's going moving out via the urine, my dear. So that's the reason urinary uric acid levels is going to be raised up. Please understand this. This is a very important complex, and with this particular table column which we have drawn is where this question is going to be derived. So the answer for this question, this patient was diagnosed with acute gout and patient was planned to be treated with acute gout, and now he is under therapy with an uricosuric agent or an anti-gout medications The total uric acid levels in 24-hour urine sample has significantly increased compared to the before treatment values. That's why this patient is currently under therapy with an uric agent, which is Probenecid. What about allopurinol? Allopurinol will not increase the urinary uric acid levels. It will just decrease the serum uric acid levels. Colchicine, no guys, प्योरली एंटी इन्फ्लेमेटरी मॉलिक्यूल होगा, तो इन्फ्लेमेशन जो है, अगर इन्फ्लेमेशन है पेशेंट का, कोल्चिसिन यूज कर सकते हैं. यहाँ पर इन्फ्लेमेशन नहीं है, सिर्फ क्रॉनिक गाउट डायग्नोस किए थे हम लोग. तो अगर क्रॉनिक गाउट में है तो यूरिक एसिड एक्सक्रीट करना ही पड़ेगी, या यूरिक एसिड लेवल्स जो सीरम है उसको कम करना ही पड़ेगा. और इंडोमेथासिन भी होगा, नॉन स्टीरॉयडल एंटी इन्फ्लेमेटरी ड्रग्स सिर्फ इन्फ्लेमेशन को यूज करने चाहिए. So the answer for this question is so direct. Probenecid is the answer for this question.